Everybody. My name is Petra and I'm coming from Germany, as mentioned before, together with my colleague. We have two talks on the topic children with CSU, and CSU is standing for chronic spontaneous urticaria. And I was thinking about how to start and how to get through the next 13, 14 minutes. And I hope you will gain a lot of information and a lot of new things. And at the end, Caroline will talk about things what you could use in your daily practice as well. So, and if you have questions, again, you can ask us at the end all together. So now I can't go forward. With my slides. Sorry. I'm in the talk already now. Now it works. So let us start. Coming from Germany, and we had some years ago, we had a special Urticaria Day for kids, especially for chronic urticaria kids. And you see one picture with my colleagues and the children who suffered from urticaria at this time point. And maybe you all know we have worldwide different urticaria centers of excellence and reference in urticaria, and the people here are part of it. And we have the possibility to do some special work in this excellence and reference centers and join or combine this with other centers worldwide. And we have one special topic where we are looking for is urticaria in children, the so-called Your Child program. And I want to share some really nice information about this project, where we are coming together with urticaria specialists working in the topic urticaria for children, for chronic urticaria for children. And we have the first results, and maybe you will have the information now, and it's not published because it's very fresh, and I hope you will join it. And some of the questions here, we asked the specialists 30, 40 questions about what do you know about urticaria in children? How do you treat your children? How do you diagnose the children? And what would you recommend your colleagues to do it? And as you can imagine, it is different over the whole world, because the world is different, and we took together all information from the whole world and put it in this results. And I will give you some first results during my talk. What do we know about chronic spontaneous urticaria? And I think it's always really important to start with something what we know, to encourage, and that you as a patient know, okay, I'm not afraid any longer about the disease. It's not a contagious disease. That's really important. No hereditary illness, no malignant illness, and not a disease for the whole life. It's different to atopic dermatitis. It's different to psoriasis. So it never lasts the whole life. This is really important. On the other hand, what do we not know? What don't we know? Why do some of us get this disease and others don't? Triggers and causes. Do we really know the triggers and causes in children? We are talking about children today. How can we avoid this disease? Can we avoid the disease? And what is really interesting, and there is one group working on this, can treatment avoid the chronification? So if you have an acute urticaria, it lasts not longer than 6 weeks. How can I avoid the chronification? This is really important, and those things we do not know. We think we know something, a little bit of it, but there's a lot of things to do in the next months or years. It's a common disease in every age and in every culture, and we have not a lot of good results over the whole world. What's about this urticaria in children? And we did work in Germany where we looked in insurance company numbers, and there we could see that we have about 3% in the in the younger children, 0 to 3 years old. But this is not only chronic, but also acute urticaria. So we have only those numbers together. But what is important on this slide here, that girls and boys can get the disease in the same level, in the same percentage, because in adults we always think and know that women have the disease more often than men. In children, it seems to be the same level. What's about comorbidities? Do we talk about a skin disease, or do we talk about chronic systemic disease like psoriasis as example? And we did those things as well with this insurance company data, and we could show that we have the blue box are the urticaria people, the other box are the small patients without urticaria. And what we can see that we have more comorbidities in urticaria patients, overall depression, anxiety, and so on. And Caroline will talk about those comorbidities and how to handle and how to realize this a little bit later. So I won't go in more detail in this. What's about the diagnosis? What are the symptoms? And we can have, if we talk about urticaria, hives with itching and or angioedema. And some of us, some patients, some children, they think they have two different diseases. And that's one disease. And I want to go a little bit in more detail in this, because sometimes you as a patient, you can't understand, it looks different. Why should it be the same disease? And we have different forms, subtypes from angioedema. Those angioedema belonging to urticaria, to mast cell dependent angioedema. Those last not longer than 48 hours, and they respond to antihistamines or corticosteroids or omalizumab. So to the treatment we know for chronic urticaria, you will hear in the next talk about the treatment options. What we did in former times, we looked for the mast cells in our skin, because the mast cells are the key players in the urticaria. There are some other cells, but mast cells are really important. And if they are a little bit annoyed, they release different things, and then you get the symptoms. And what we could show is that the mast cells, everyone has about the same amount of mast cells, even if people have urticaria, but the mast cells are different in the skin layers, so a little bit higher or deeper. Different depends on where we look for the mast cells, in which regions. And on the other hand, we can find in different body parts different amounts of mast cells. And therefore, we know that if the mast cells are more often in special skin regions, what you can see in the red color here, and they are lying deeper, then we have angioedema, the clinical picture of angioedema in more other region. They are higher and not so present. Then we have more the urticaria, the hives. And that's why the disease is looking different. So we have hives and or angioedema. Most of our patients have both. Some of them have only angioedema, even in children. And most of them have urticaria, the hives. And why do we speak about urticaria as the name of the disease? Maybe I can't see you, but maybe you know this plant. It's called Urtica dioica or Urtica dioica. It's Latin. And if you have contact with this plant, you get a lot of those symptoms, those hives. And that's the same picture as our disease urticaria shows. And therefore, we call it urticaria, coming from this plant. And why do we get those symptoms? Because the topic should deal a little bit about, or with the term of the itch. We have those mast cells in our skin. And if the mast cells they release at any time. We don't know exactly why, and sometimes they release a lot of things, for example, histamine, and then we get the symptoms like itch, like hives, like angioedema. That's the whole thing we should know about this, not more. And no, it's not two diseases. It's one disease with angioedema and or hives. Some pictures of our clinic for the patients, of course, and we did in 150 children, we looked who of the childs have hives, who have only angioedema, and who has hives and angioedema together. And you can see the picture. More than 40% have both hives and angioedema. It's nearly the same as in adults. What's about other diseases which could look similar to urticaria? And normally urticaria is a really easy to diagnose disease, but if we look to the symptoms of redness and so on, we have sometimes those symptoms at the skin. It looks like a rash, like urticaria, but it's not, because those people, they have no itch dominant. And that's called autoinflammatory disease, but that's not only redness and sometimes a little bit like a hive, but they have presence of inflammation, they have pain, they have fever, they have fatigue, and it's only coming in waves, and it's really different to urticaria, but it's very seldom. And if someone has those symptoms which I mentioned before, you should think about this, but normally you can give the disease urticaria, really, you can diagnose really easy. What's about the subtypes? We talk today only about chronic spontaneous urticaria, but of course we have inducible subtypes like cold urticaria, like delayed pressure urticaria or cholinergic urticaria. So I don't talk about this, but it's important that you know every fourth, even in the children, they have two subtypes, and you should always ask for the second one as well. Or you as a patient or as a parent, you should give the information if it's only a spontaneous form or and inducible forms. We have some inducible forms here, only some pictures, cold urticaria or this dermographism, where you can make pressure on the skin and you can find those hives where the pressure is, or the cholinergic urticaria, where your body temperature, your cord body temperature is raising, and then the symptoms come up, or the heat urticaria. What's about diagnostic tools? And this is a pity, because we have only one or two diagnostic tools which are validated for children. Most of them are only for adults, and here we have a lot to do, a lot to work, that we can have the things for children as well. Pathology, that's a mast cell, and we talk about autoimmune disease type 1 and type 2b, where the mast cell release a lot of things like histamine, like tryptase and so on, and then symptoms occur. What's different to former times, that stress, special food, drugs, infections can provoke urticaria or can increase the symptoms, but it's not the reason why you get the disease. That's really different. That's trigger, but not the reason. That's different to former times, and that's really important to understand. Here, one picture of a child, of a urticaria child in our hospital, where they should send us some pictures, and she was thinking about triggers in her bowl and so on. One last picture, what should we look for when we look in children? You should only do once a blood test to look for infections and so on, maybe for TPO. You will hear something about the treatment as well in the next talk, and IgE, but nothing more. In children and in adults, the same recommendation. Good. What else do we need? And I'm finished now. What else do we need to manage the CSU, the chronic spontaneous urticaria? You need always colleagues as a physician who like the disease urticaria and you who could help the patient to treat, to manage this disease. And of course, we need patient organizations because they can help us and help you to manage this disease, that we have a short disease duration. That's our goal, and we can treat to get a disease control. That's really, really important. And I would like to recommend to work together with pediatricians, dermatologists, or specialized dermatologists. Go hand in hand, never give up, and we are looking forward for the next World Urticaria Day. Thank you so much.
Thank you, Petra. Great talk. And please don't forget to write your questions on the chat, and we will read them at the end. And with that, I would like to give place to the screens are yours, Larissa.
Well, hello